Hello, everybody. I'm Brad Parkinson, and this is Planet Health Project, or the Planet Health Project, and I'm with my partner in wellness, Mr. Shannon Burford from the Cura Integrative Medical Clinic in Western Australia, and we're doing a podcast or a video, depending where you're hearing this, on IBS, Irritable Bowel Syndrome. Shannon, this is quite a common common condition that we see in clinic, very hard for GPs to address, and incredibly problematic for many individuals. And we do have a lot of good approaches in treating this condition. Well, first of all, what is it? And what I'd like to start off with, oh, by the way, hello, Shannon. I haven't really given you a chance to introduce yourself. And I might start off by just saying what the Rome 4 criteria is. Now, when we went through school and studied this, we were looking at the Rome 2 and the Rome 3 criteria. And I know in practice, practitioners were really sticking more to the Rome 2 criteria. And I'll mention what the Rome 4 criteria is, and then perhaps you can elaborate on just general symptoms and generally what we're dealing with in our clinic environments. So the Rome 4 criteria is as such, says for the diagnosis of irritable bowel syndrome require the patients have had recurrent abdominal pain on average at least 1 day per week during the previous 3 months that is associated with 2 or more of the following. Related to defecation, it may be increased or unchanged by defecation, the symptoms that they're dealing with. Associated with change in stool frequency, or associated with a change in stool form or appearance. Now, yeah, is this a great guideline? Rome criteria always seems to be criticized when it comes out. Like I mentioned, a lot of patients or a lot of practitioners were sticking with Rome 2 criteria when the Rome 3 criteria came out. And really, as these guidelines, while they may be appropriate for a diagnosis, in my view, it's usually a diagnosis of excluding other serious pathologies like inflammatory bowel disease and so forth. And when people have gone through all these other things, then you take the approach that it is IBS and you then treat appropriately. But yeah, do you perhaps have your views on that and you want to elaborate on that a little bit?
Yeah, definitely. You touched on heaps of great stuff there about, well, the number one, and I love just simplifying it. Basically, IBS, digestion is not working. You've got diarrhea or constipation. And the top thing is ruling out, of course, blood, bowel cancer, inflammatory bowel disease, as you said, and something more sinister. And once you've got that out of the way, then why is the digestion not working? And there can be so many different reasons. So rather than give it an umbrella term, IBS, which basically is a way of saying, well, we don't really know if it's too hard, maybe some laxatives. If it's too soft, maybe some gastro stop, or just something in between. But really, what is the cause? And that's where we come in, and we're really good at helping with that multimodality approach for diet and lifestyle and herbs and stress and all of those factors that are influencing the gut function.
And with this whole picture, because it's a syndrome, it's there's multiple things going on. I guess we include things like small intestinal bacterial overgrowth and or dysbiosis. I mean, these are all things that sometimes are targeted treatments. We target treatments for those specific things. You see SIBO specialists, you see microbiome specialists, or dysbiosis will come up across various conditions, because really when we're not healthy in general, the microflora is generally out of whack. So I take the approach, if I have an unhealthy individual in my clinic, where's their microbiome at? What's their microbiota doing? So, there are people that look at perhaps SIBO as a separate condition. But I think IBS can be considered an umbrella term that might house these different conditions or states of physiology. What's your thoughts on things like SIBO and dysbiosis under this sort of whole irritable bowel syndrome picture?
Definitely, and I think that's always a factor, is dysbiosis, changes in the flora. But I guess we as humans, we want to know, and if we're sick, we want to know what's the cause of it. So I have this poor digestion, I'm always bloated, or I've always got constipation. I want to know why.
Yep.
So trap to fall into to say, it's IBS or it's dysbiosis. But as I'm sure you would agree, if only that simple. So it's a combination, and the patient might be sitting there and then you're thinking, I can see their stress is off the chart. They're having these instant meals, or they're having a lot of takeaway. And their stress is the number one thing. But then they've got dysbiosis as well, the changes in the flora, and their microbiome is out. So yeah, so it's always complex.
Yeah. Okay. Well, you touched a little bit on, we're talking about causes, and we're very good at looking into that. And I guess what ties into that is the mechanisms. You know, what is causing them, and what's the function or perhaps dysfunction going on with our physiology. Do you want to talk a little bit about that?
Sure. So as I said earlier, I love to simplify things. So if we think about just step by step from your mouth, so you're eating the food. So first of all, there's the food. What are you putting into your mouth? Could be high in fats, saturated fats, could be really high refined sugars. You might not be chewing because you might be stressed. Then that's getting the enzymes going. Then it's going down into your stomach. Are there problems with the sphincters? Are there problems with the gut bacteria? Is there a problem with inflammation in the lining? Of course, acid production. Then you've got liver, so the liver bile, processing fats and proteins. And then you've got the pancreas, same thing. And you've got the small intestine. And already we've gone through all of these processes that things could go wrong along the way. And then you've got the large bowel as well. So the brush border, the secretions, the bacteria, the fungus, the viruses, the parasites. And then you've got the and then finally you pass a stool and hope that it's gone along the journey and you've absorbed everything adequately, and you haven't caused too much flatulence and pain and all of that. So and along that way, so many things can go wrong, and usually multiple things.
Yeah. And a big part of or a big focus on some of the literature in recent years has been peristalsis, so the movement of the bowels to move out the stool through the intestines, and this, I guess, view of serotonin playing a big role in controlling peristalsis. So when we're getting constipated or there's diarrhea, and I don't know if it's come up with any of your patients on medications like SSRIs and so forth, and not that I've looked at the literature extensively on this, but there's been many people talking about how when we are having something like a serotonin reuptake inhibitor, it's giving a message back to our gut saying, hey, we don't need any more serotonin, there's plenty up here. And what a lot of people don't realize is that things like our neurotransmitters, like serotonin, melatonin, they are all produced in the gut, and then they're also used. Like melatonin's a very good antioxidant in the gut as well. So our gut function relies on those neurotransmitters as well. So yeah, there's so much that connects it all together, isn't there? And you know, as you went through the digestive tract there and what's going on. There's many things that you need to address and make sure are working efficiently. Okay, so look, we're getting a bit of an idea what's going on. Of course, it's a lot more complex, and we could go on for a very long time about all different mechanisms and look, the research is mounting in any one of these areas, like SIBO, for example, or dysbiosis, or the serotonin hypothesis, I guess you call it, in relation to peristalsis and so forth. So, what can be done, Shannon? What's the I guess talk about the conventional medicine approach, how they're limited, perhaps, and what usually is done from their perspective, and how can we go about it as naturopathic practitioners?
Yeah, so I guess the conventional medicine is quite limited in the treatment, because if we strip it down and we try and isolate it, well, what's the one cause? You could go and say, well, let's give laxatives. You know, the stool needs softening, so laxatives is the answer. But as we said earlier, it's complex, and it's better with a multimodality approach. So combining treatments is the best way, and that's what a naturopath or herbalist would do. Mm-hmm. So conventional medicine might also more recently look at diet, like the FODMAPs diet. So luckily we are shifting over and thinking about diet and limitations. But once again, that is being a bit limited, because we're not going to stay on a FODMAPs diet forever. That's not the ideal result.
But how often does it happen? You get a patient come in that they've been strict FODMAPs for a long time, and then the limitation of certain fibers then creates and alters their microbiome in a negative way. And it's one of the most, I won't say most, but it's one of the very common problematic things we deal with as practitioners for people that get on these FODMAPs diet and get scared to really change that.
Yeah, and you don't want to back yourself into a corner where you've restricted so much, and you might be on an SSRI, or you might be on several medications, and you're backing your diet into the corner and you're limiting things. So where is that going to head to? You're trying to increase variety and more wholesome, nourishing foods. Mm-hmm. Yeah. And so naturopathically, you asked what can we do? Of course, we've got a lovely toolbox full of a number of things, and our beautiful herbs. We have so many great herbs to reduce bloating, or bitters, or helping the liver work, or helping the acid work, helping the mood. And of course, those really paramount dietary suggestions by making tweaks in the diet. And getting the lifestyle things in order. So are they sleeping? Are they taking care of their body? And the relatively simple things, are they in order?
Yep.
What else can you add, Brad? I'm sure lots of things.
Well, look, no, I think you've covered most of it. I always love the herbs because, for example, we use carminatives to settle the gut, dispel wind through the system, but at the same time they can work very well for anxiety. And I often find this in practice, that anxiety accompanies IBS, because stress is usually a huge factor. And you know why in certain times when you've got that bloating going on, you're full of gas, it creates an anxious state. And where the herbs come into play, they can calm that situation right down from a physiological point in the gut or digestive system, as well as usually having a bitter action at the same time. So one herb can have a bitter action, a carminative, gas dispelling action, as well as calm the nervous system at the same time. So we've really got some good tools there to use. And I guess touching more on stress as well, when we do implement lifestyle changes to help them better adapt to stress. Again, we can add herbs into that equation as well. And obviously can also work on things like sleep really help them recover better and restore themselves as well. And I usually deal with things like stress and anxiety a lot better. So, all right.
Brad, if you were to choose, just, I know there's so many great herbs, but give the viewers one of your favorite herbs that you would use to treat IBS, what would it be?
Well, that is a very hard one, because there is, I've got about 4 that just come up straight away. And it depends, like if there was more liver involvement, and you might go peppermint. If there's more anxiety involvement, you might look at lemon balm, though specific to IBS too, you quite often get good results for something like Cynara, Globe artichoke. So, and then there's a heap more like chamomile, and chamomile for younger people was fantastic. So, yeah, sorry, can't give you one. Can't do it.
I'd say a hot tip for people watching, if they've got IBS, is chamomile. I often say get 3 or 4 tea bags. So from the supermarket, they're very weak, but if you get 3 or 4 in 1 cup, make it really, really strong, and it should be really bitter, and have that a couple of times. It works a treat for a lot of people.
Excellent advice. Excellent. All right, Shannon. Well, I think that'll just about do it for IBS, irritable bowel syndrome. And yeah, where can the folks at home find you?
So as you mentioned, I'm over in Perth, Cura Integrated Medicine. Jump on the webpage, curamedicine.com.au. And you, Brad?
They can find me at bradparkinson.com.au or Brad Parkinson Naturopath on Facebook. And yeah, look out there for posts and information and these videos. So I think that'll about do it, Shannon. Bye for now.
Take it easy.